I'm Dr. Deptee Warikoo, Department of Physiotherapy, Dolphin PG Institute of Biomedical and Natural Sciences. Today we will be discussing about the kinetic chain exercises. The kinetic chain in the engineering sense are composed of a series of rigid links that are interconnected by a series of pin-centered joints. The system of joints and links is constructed so that motion of one link at one joint will produce motion at all of the other joints in the system in a predictable manner. The kinetic chains could be open or closed kinetic chain. While we define them in rehabilitation settings such as sports and physical therapy clinics, the body is often viewed as functioning in interconnected segments. For example, our arm, shoulder, our spine, our hip, our knee, ankle, they all work interconnected. Kinetic chains were used to describe how forces occur during human motion and how segments of the body are linked together. So we have two types of kinetic chains. The kinematic chain can be open or closed. In an open kinematic chain, one joint can move independently of others in the chain when one end of the chain remains fixed. It creates a closed system or closed kinematic chain. Under these conditions, movement at one joint automatically creates movement in other joints in the chain. So closed kinematic chains, like we do squatting, involve weight bearing. So here the distal segment is fixed or stabilized relatively to the proximal segment, and they are mainly used more often in rehabilitation for the lower extremity. In closed kinetic chain exercises, movement at one joint produces predictable movements at all other joints. In the open kinetic chain exercises such as active knee flexion and extension or active shoulder flexion and extension of the leg or shoulder do not involve weight bearing. So distal segment is mobile. In contrast, open kinetic chain exercises use isolated joints and muscle functions at the motion, and the motion is uniplanar. Here you can see the distal segment is mobile, not fixed, that is an open kinetic chain exercise. Here we see increased acceleration forces, decreased resistance forces, and increased distraction and rotation forces. So when we see the open kinematic chain exercises, they can be used to improve the strength and function of an isolated muscle or group of muscle. This can be beneficial in the early stages of rehabilitation program or when the improving aesthetics, such as for a bodybuilder. However, closed kinetic chain exercises may be more beneficial in some circumstances. Now, closed kinematic chain is when the distal segment of the extremity is fixed, or we say it closed. So here there is increased joint congruency, thus stability factor plays an important role. There is decreased joint shear forces, decreased acceleration forces, and large resistance forces occurring. We can say the closed kinematic chain plays an important role in stimulation of proprioceptors. So what are the factors which affect the closed kinematic chain exercises? It could be biochemical, biomechanical and neurophysiological. The biomechanical factors in closed kinematic techniques emphasize the sequential movement and placement of functionally related joints and therefore require coordinated and sequential muscle activation patterns. When we talk about the neurophysiological factors, the closed kinetic chain exercises stimulate the proprioceptive system, as we already seen. So, a proprioceptive feedback is helped to initiate and control muscle activation pattern. That is why we say that they are more useful in dynamic stability. Now, when we talk about the clinical relevance, closed kinematic chain movements are often used to strengthen the core and the postural muscle. A benefit of closed kinetic chain exercises is that the movements they promote often relate better to activities of daily living. So we call them functional. Sometimes in rehabilitation, a person will use open chain exercises to strengthen an isolated area and then further move to closed kinetic chain exercises. Here you can see the example of open as well as closed kinetic chain exercises. Now, if we talk about the technique, The open kinetic chain exercises are performed typically where the hand or foot is free. Exercises are mainly non-weight bearing, so the movement occurring at any joint like elbow or knee joint will be non-weight bearing. If there is any weight applied, it is to distal segments. Arm open kinetic chain exercises include the bench presses and leg presses, and the knee extension and straight leg raises. For legs, concentrate on a strong quadricep contraction, which will strengthen the quadriceps and restore quadricep power output. When we talk about the closed kinetic chain exercises, they are physical exercises. They are performed where the distal segment is fixed, like the hand or foot remains in constant contact with the surface, usually the ground, or if we are using any machine. These exercises are typically weight bearing exercises, so we use our own body weight or any external weight to strengthen our muscles. Closed kinematic chain exercises could be used after anterior cruciate ligament reconstructive surgeries. They appear to have gained popularity over more traditional used open kinetic chain exercises in recent clinical advancements. So when we talk about the muscle actions in kinetic chain exercises, we see the open kinetic chain exercises, the muscle origin is fixed and the insertion is moving. While in the closed kinetic chain, the muscle insertion segment remains fixed and the muscle works to move the origin. What are the advantages? As we already discussed, the closed kinetic chain exercises will have increased joint compressive forces and stability. They will have a decreased shear forces, decreased acceleration forces. They will help to stimulate proprioceptors, therefore enhance the dynamic stability. They are less harmful, more safer, and produce less threats. Co-activation and co-contraction of the muscles occur and they are functional and very sport specific. In sports, we majoritarily use closed kinetic chain exercises. The open kinetic chain exercises are used primarily to develop muscle strength because they use increased acceleration forces, decreased resistance forces, there is increased distraction and rotational forces, there is increased deformation of joint and muscle mechanoreceptors. They mainly promote functional activities and are often isolated to single joint movements or motion. Here you can see closed and open kinetic chain exercises. In figure A, you will see a closed kinetic chain where the distal segment is fixed, and in B, you will see an open kinetic chain exercise. Now let us differentiate between these two exercises. So first, we all know now that the distal segment moves in open and remains stable and stationary in closed kinetic chain exercises. Secondly, the independent joint movements are present in both, but there is no predictable joint motion in open chain exercises, while there is predictable movement patterns in adjacent joints in closed chain exercises. The movement of body segments only distal to the moving joint occurs in open chain, where the movement of body segments may occur distal or proximal to the moving joint in closed chain exercises. While we focus on the muscle activation pattern, it occurs predominantly in the prime movers and is isolated to the muscles in the moving joints when we focus on to open chain exercises. When we talk about closed chain exercises, the muscle activation occurs in multiple muscle groups. It could be distal, it could be proximal. Next, we see typical open kinetic chains are performed in non-weight bearing and closed kinematic chain are performed in weight bearing. The resistance is applied to the moving distal segment in open chain exercises, and resistance is applied simultaneously to multiple moving segments when we talk about the closed chain exercises. Use of external rotatory loading is helpful in open chain, but use of axial loading is used in closed chain exercises. In open chain exercises, we use external stabilization, while in closed chain exercises, the internal stabilization by means of muscle action, joint compression, and congruency and postural control play an important role. This was the differentiation between open and closed chain exercises. Now, what are the common examples for the open chain exercises? The common examples are like biceps or leg curls, bench presses, raising of your arm, lifting a leg, waving a hand, or extending the lower leg from the knee while sitting. Here you can see few of the examples of open chain exercises. Then closed chain could have yoga, cow stretches, hip bridges, squats, lunges, wall slides, push-ups, pull-ups. Closed kinetic chain exercises are used mostly in lower extremity rehabilitations. In sports medicine also we use closed kinematic chain exercises more popularly, like squats, wall slides, leg presses, lateral step ups, lunges, slide boards, terminal knee extensions, and mini tramps. Using a closed kinetic chain exercises to regain neuromuscular control is very important nowadays because lack of normal motion due to injury disrupts movement at multiple levels. Closed kinetic chain activities require integrated action of all segments, which thereby facilitates proprioceptors and joint position sense. There is better understanding of kinesiology and biomechanics has allowed for increased and earlier use in rehabilitation of closed kinetic chain exercises when we consider the lower extremity. Number of lower extremity exercises are more available in closed kinetic chain exercises. Now in this video we will see how these exercises differ and how they are basically performed. Now, if we see this video, we see properly that here is how muscles are attached in our body and then fixed to a point. Now, the activities are occurring, muscle is pulling from both the sides. We can see in the video. In open kinetic chain exercises, the distal part is free to move. Like you can see here, the patient is performing the biceps curls. If the distal part remains fixed, like here you can see, this becomes a closed kinetic chain. The hand or foot is fixed in space and cannot move while we see in closed kinetic chain exercises. Here you can see standing is in closed kinetic chain. You can see sitting to standing. And while we perform, this is again a closed kinetic chain exercise. You can see most compound exercises are basically closed kinetic chain exercises. This is again a closed kinetic chain exercise. The push-ups where the distal segments you see are fixed. Then we perform active exercises which are mainly open chain exercises. Like here we see it is again an open chain exercise. Like see here, the distal segment is free. So these are open chain exercises. Thank you so much. Hope you understood it properly. If there are any doubts, you are welcome. Thank you so much.